Oh, good. Um, well, good morning, everybody. And thank you to Dr. Levis, who's here, the chair of MacGlObAS, and David Oldenburger, and everybody at MacGlObAS for putting this combined rounds together. Um, my name is Brad Petrosor. I'm an orthopedic trauma surgeon at the Hamilton General and also associate chair for education in the Department of Surgery. And it gives me great pleasure to be able to introduce Dr. Tiande, or Robert, who's been working with us for the past year. And David, there's no housekeeping things we need to do. So just as I move through the slideshow, any of those technical difficulties that you saw were mine. So Robert is from Uganda, and he's an orthopedic surgeon. He was born in exile in Juba during the 1979 Liberation War, or the Uganda-Tanzania War, that saw the overthrow of Idi Amin. And he was born in Juba, which was Sudan at that time, but is now South Sudan. And he works now in Arua in the northwest of Uganda on the border of Congo, which is over here, and Kenya, which is over here. And you'll note that he works in one of the areas, since we're talking about global surgery, where there's a significant proportion of people who really do, according to the Lancet Commission and the world, know that there's a significant proportion of people that lack access to safe surgical care and anesthesia. That many more surgical procedures are needed to prevent years of life lost and disability in this area of the world. As well, there are people that suffer from very significant catastrophic financial impairments from these injuries and from not getting access to surgery and anesthesia. Robert was trained in Gulu University and did his Bachelor of Medicine there. And Gulu, for those who don't know, is home also to St. Mary's Hospital, Lachore, which, if you haven't been there, is an amazing place to be. They are very well set up for visitors. They've been doing collaborations and for years. And Lucille Teasdale, in the middle you see here, was a pediatric general surgeon trained at Saint Justine in Montreal, and married Piero Corti, who was a pediatrician from Italy. And there's the Teasdale Corti Foundation, which is a Canadian-Italian foundation. This, I believe, was Matthew Laquia, who passed away. He ran the hospital as well after the Teasdales and Cortis passed away, and asked to be buried next to them at the hospital grounds. And he passed away from Ebola when they had the largest outbreak there. So this hospital, if you haven't been there, it'd be something I would urge people to look up and think about, because they're very, very well set up for visitors and are very, they like that. But that's Gulu. And then Robert went on to Makerere University to do orthopedic surgery residency. And so this is combined with Makerere University and the Rodney Belcher Department of Orthopedic Surgery. He's going to talk a little bit more about that, mainly at MacGlObAS Hospital. And this is the hospital there. It's just undergone a refurbishment, but the orthopedic department sits up on a hill, and MacGlObAS and Makerere combine to train orthopedic surgeons and other surgical subspecialties there at MacGlObAS. Robert and I first met in 2016. This picture is from 2016. It's in the Department of Orthopedics at MacGlObAS Hospital, and we're doing some workshops. And he was a second-year resident, right? Then, and so that's when we met initially, and then he finished and went up to do some practicing in Arua, and has now come to us. This was a picture that I took of him yesterday at the end of our busy fracture clinic, and he's smiling. So at the end of a busy fracture clinic, he's still smiling. That speaks to his testament and the type of person that he is. But more importantly, he spent a year with us, and he's still smiling. And so that also speaks volumes, even though I said, Robert, you got to smile for the picture. Anyway, I wanted to also acknowledge that he's part of the International Outreach Program, who sponsored his time here. MacGlObAS has helped sponsor some initiatives for him in McMaster PGME, and as well as working at the Hamilton General with us. So without further ado, I would like to invite Robert Tiande, or Dr. Robert, or Robert Hein Tiande, up to the platform to give us a talk on orthopedic services in Uganda public healthcare system. You are live, and I'll need to stop sharing this.
Thank you. Thank you. From there, right? Okay.
Just let me share.
Okay. Yes, thank you very much for giving me this opportunity to share with you the little that I know about the public service in Uganda, and especially in relation to the provision of orthopedic services. My name is right there, and I thank you all for sparing some time to come and share with me whatever I have. Now, when we talk about orthopedic services in Uganda, before independence, that is before 1962, there's little documented about the provision of orthopedic services. However, from 1960 onwards, something started to be documented. And the first person to be documented to have provided orthopedic services in Uganda is Professor Ronald Huston. He's a British Australian who worked between 1960 and 1971, where he was appointed as a professor at the Department of Orthopedics at Makerere University. Now, during his work, there is a lot that he did. The first thing is to try to, one, author a book that can be used in a low resource income setting to manage trauma patients. That's just the cover page of the book that he authored. He again went ahead to fabricate a wheelchair that is somehow hidden at the lower bottom corner, which he thought could help in a low income resource setting. And of course, besides that, there's a lot that he did, fabricating implants and the rest of the things. After Hartstepp, there came Professor Rodney Belcher. I would say Professor Rodney Belcher is the father of orthopedic practice in Uganda, because he's responsible for the training that is right now taking place in Uganda and parts of East Africa. So he first came to Uganda in 1983, but somehow he had to leave because of the war that Dr. Petriso just mentioned about. But during his time in Uganda, he was able to establish an orthopedic workshop. Why did he establish an orthopedic workshop? What attracted Professor Rodney Belcher to Uganda was poliomyelitis. And Uganda and the other East African countries were getting a lot of patients or children with post-polio paralysis. So this attracted him to come to Uganda and, of course, start doing something. One of the first things that he did was to open up a hostel. That hostel now has become the spine ward. For those of you who have been in Mulago, the current spine ward was a hostel for polio children. After that, he opened up a workshop where he could fabricate the appliances these children need, the calipers, the wheelchairs, the crutches, and all the rest. Of course, subsequently, he became appointed as a professor and subsequently the head of department of the Department of Orthopedics at Makerere University. In 1994, he started a residency training. However, before he could see his first admission, he passed on. He was killed in the parking lot of his office in a car hijacking incident, which was a very painful incident. And because of that, yearly, the Ugandan Orthopedic Society remembers his service by having the Rodney Belcher Memorial Lecture conducted every March. and this has been on for the last 3 to 4 years. You can see on your left-hand side about 8 men, most of them dressed in blue. But there's something common you'll notice amongst themselves, that there are those who have crutches, and are those who have canes. These are the workers in the orthopedic workshop. When Rodenbelcher started his work, what he first did was to treat these people and identify those who could work in the workshop. And he trained them to work in the workshop. Some of them have continued to work there. Some of them have retired from there. So patients became service providers in the orthopedic workshop. What you can see down here is the workshop that he established. It's a very big hall with so many things. In this workshop, they're able to fabricate corsets, they're able to fabricate orthosis, they're able to fabricate crutches, wheelchairs, and everything that can help aid rehabilitation of an orthopedic patient. Besides that, he identified that it was difficult to get surgeons trained. So he chose for an alternative, that is to first train personnel, what you have here, like the cast technicians, who would then be able to provide this service to the people. So he opened up what we used to call Mulago Paramedical School, but it's now called the Uganda Institute of Allied Health and Management Sciences. So in this, they train the cast technicians for a period of 3 years. They also train what you call the orthopedic technicians and the orthopedic technologists. The technicians and the technologists are the people who fabricate the orthosis. So that's the first category of human resource that he created and started training. After that, he thought about opening the Department of Orthopedics because he realized that you cannot continue providing conservative care for fracture patients. You need to train surgeons. So that's when he thought of opening this department. Now you can see where he began from, an old building, which became the Department of Orthopedics and has continued to become the department, and continued to be the Department of Orthopedics. You can see it is named after him, Rodney L. Belcher, Department of Orthopedic Surgery at Makerere University. There's been a little bit of change to the face of this building. I think Dr. Petro must have noted when he visited recently, but that is it. And of course, below you can see health volunteers overseas. These are the people who sponsored the stay of Professor Rodney Belcher in Uganda, and these are the people who participated in training the first few orthopedic surgeons in Uganda. This Makerere University are the only public university where you can have training of orthopedic surgeons. In the next 2 to 3 years, another private university will start training orthopedic surgeons, but for now, it's only Makerere University. And therefore, it's the first university to start training orthopedic surgeons in Uganda and also for most of the East African countries. Now, to talk about the current situation in Uganda, that's our population, 45.3 million, growing at 3% rate, and our life expectancy is 63.3 years, quite lower than what perhaps you have here in Canada. But most important to note is that most of our people are young. More than 92% are less than the age of 65. So that means that we have got the young and productive age group. If they get involved in situations that put their musculoskeletal system at risk, then there's loss of productivity to the country. And yet it's a country that is fairly poor. Now, when we talk about arrangement of the healthcare system, we run a decentralized healthcare system where you have the district level and the national level. Now, what you see here are the levels that we have. Now, I decided to have this here one to show you the level of the arrangement of the healthcare system, but also to demonstrate to you at what level you can get an orthopedic surgeon. From the level of a health center 1, which is here at the bottom, to the level of a general hospital, you cannot get an orthopedic surgeon. From the level 1 to level 4, you cannot get a cast technician. So that means that if someone is within the vicinity of level 1 to 4, cannot get fracture managed, even if by cast. If the person is in a general hospital, like what you perhaps have here, cannot get a surgeon to treat this fracture. You can only get operative fracture treatment from the level of a regional referral. And regional referral begins from 2 million people onwards. So below 2 million people, you have no surgeon to treat patients. And the general hospital downwards, they are managed by the district authorities, while the referrals and the national referrals are under the direct supervision of Ministry of Health. 45% of our healthcare is public, 40% is private or profit, and then 15% is private not-for-profit. Private not-for-profit are mission hospitals, and these are faith-based institutions like St. Mary's Lacho that Dr. Peterson just talked about. That's the map of Uganda, where you see the dotted spots are the points where you can get a regional referral, but not all regional referrals serve orthopedic surgeons. As I talk, out of 16 regional referrals, only 5 have orthopedic surgeons. What about the funding? The national budget is about 52.7 trillion Ugandan shillings, and out of this, about 25% is donor funded, either through projects or direct support. We do not have a national insurance system. In terms now, there was what is known as the Abuja Declaration that was in 2001 that stipulated that all African countries should be able to dedicate 15% of their budget to healthcare. However, for Ugandan situation, you can see at the years where we had 4.8% up to about 7.5%, the most recent information I have. So which is far less than what the Abuja Declaration talked about. On this slide, what I wanted to demonstrate to you is that the breakdown of the health expenditure. You can see that 42% is spent at the level of Ministry of Health, 14% at the level of the National Medical Stores. Now, the National Medical Stores is an institution that does the procurement, the storage, and the distribution of medical supplies and equipment to all hospitals in the public healthcare system. But it only receives 14% of the healthcare spending. This tries to demonstrate how much a primary level care, a secondary level care, and a tertiary level care will receive. You can see a national referral overall gets only 9% of the healthcare budget, while the lowest level, which is the primary healthcare, gets 8%. And this is where majority of the population are. However, expenditure on policy and regulation at the level of Ministry of Health takes about 43%. So you can see the administrative cost is more expensive compared to the cost of direct service delivery to the population. Now, in terms of human resource, we have the general hospital, as I mentioned, no orthopedic surgeon. It's only the general practitioners who are graduates of Bachelor of Medicine and Surgery, who, if they have the capacity, can provide orthopedic surgical services if they have. If they do not have, then it's difficult. However, currently, there are general surgeons who are employed at the level of a district. If they have the capacity to do some few orthopedic surgeries or managing them, then they will be able to do that. When you come to the level of the regional referral, the regional referral, as I mentioned, serves about 2 million people and supposed to have a senior consultant orthopedic surgeon, supposed to have an orthopedic consultant orthopedic surgeon, and what you call a medical officer special grade orthopedic surgery. That is the entry-level surgeon position, and that's the type of position that I've been holding in my hospital. So we have those numbers that you can see on the right-hand side. Now, if we look in terms of percentage of how many of these positions are filled in the regional referral, which covers 2 million people, 0% for senior consultant, 19% for consultant, and 16% for entry-level orthopedic surgeon. When you look at the national referral, they have an approval of 3 senior consultants, 3 consultants, and 8 entry-level surgeons. And when you look at the percentage of these positions being filled, 33% for senior consultants, 100% for consultants, which is good, and then 75% for entry level. So you can see that the national referral is fairly well staffed compared to down, but majority of the people are down. And for those who know the geography of the country, the average distance between the farthest point to the central is about 500 kilometers. So imagine a fractured in Arua and they have to bring me to Mulago, which is 500 kilometers away. in a system where even the Land Cruiser ambulances are not readily available, where we cannot even dream about the choppers which bring patients and land on top of Hamilton General Hospital. Not even that. So you can see. So if I fracture, then I might die in Arua before I reach Kampala. In terms of the number of orthopedic surgeons, we have got about 85 as of yesterday. And in general, they have trained about 130. However, some of these are international students. In terms of subspecialty, we have got those who are employed by Ministry of Health, those who are employed by universities. I've put a breakdown. But overall, eight arthroplasty surgeons, 2 sports medicine orthopedic surgeons, 5 pediatric orthopedic surgeons, 8 spine, 3 trauma. In total, 26 have got the training to offer subspecialty services. This is the hospital where I work. You can look at the orthopedic services. It's a storied building. And then you look on your right-hand side. That old building is the Department of Orthopedics. And that's where I served for about 1.5 years before I left to come here. And after here, I'm going back to that building you see. The outpatient department, you can see it's a very nice structure built by the Japanese government under JICA. And then on the right-hand side, where you're seeing a gentleman with a red shirt is the orthopedic ward. You can see how crowded it is. The other part is hiding some patients on traction. The ceiling is dropping. So that's the type of environment in which we work. So in general, there's inadequacy of resources that are needed to manage these patients. 92% of the patients in our public healthcare system with fractures buy their own equipment. 92%. You come to the hospital, the equipments are not there. What my work is to give you a prescription. If I need to work on your femur, I prescribe IM nail, this size, and then you go and buy. The supplier either sterilizes it or it's brought to the hospital, is sterilized, work on you, and then the instrument set is sent back. So 92%. The other 8% get support from donations. I'm grateful that organizations that move from outside the country, when they go for camps, they go with some equipments and implants, and then they're able to leave part of what they have moved with. For example, if they have gone with a number of IMAs, so not able to use all of them, they leave some. And Dr. Peterson knows this. USTOP, that is Uganda Sustainable Orthopedic Program, has been doing this for quite a long period of time. And it's a Canadian-based institution, mainly under the University of British Columbia, and with the affiliation to staff of McMaster University, just like Dr. Peterson here. So the 8% are the people who benefit from such leftovers, let me say, leftovers. 23 will get fracture fixed within 2 weeks. The other 77% beyond 2 weeks. I decided to put this slide here to show you that if I want to work on a patient and the implants are to be delivered in my names so that I can easily pick it, it has to be packed and my name written on it. It has to be taken to a bus station. The person has to pay for the bus and it has to be delivered to me. Where I work is about 8 hours drive from the city. So to send for me the things that I work and it goes back. So how have we tried to fill the gaps that I've mentioned? We have the Orthopedic Society of Uganda. This photo was taken during one of the camps that we had in Western Uganda. Those are the officials of the society. So the society has come up to try to fill the gap by organizing workshops. You can see on your right, they have organized a workshop for non-operative fracture care. The participants are general practitioners, the cast technicians, and other health practitioners. So they are learning how to put a cast for a humerus fracture. in a hotel. Now, on your right-hand side, you can see a basic principles of fracture management workshop organized also by the Orthopedic Society of Uganda, where people were learning how to ream the femoral canal. They have organized conferences, they have organized surgical camps, as you can see on the slide. This is the Uganda Sustainable Trauma Orthopedic Program that I mentioned. They have done quite a lot. I think they started coming to the country around 2014, around 2011, and have continued to move to Uganda. They were disrupted a little bit by COVID. However, this year they resumed about 3 to 4 weeks ago. They were in Uganda and have done a lot. As Dr. Peters showed on one of his slides, I did not even know that he had my photo in one of his slides of 2016. So we are learning how to put an X-fix on bone modules. So they have really done a lot to put shape to the department and also to train the personnel. And then there are also other institutions like the Health Volunteers Overseas that took Professor Ronnie Belcher, the father of orthopedic surgery in Uganda, to the country, Duke University, other local partners, and so many others who have continued to provide service to the country, either directly or indirectly through institutions that partner with the university. Fellowship opportunities have also been extended to the country. Of importance to me that I should mention is the St. Joe's Healthcare System International Outreach Program that has reached to 16 developing countries. I'm very grateful that Uganda is amongst these. And I'm also grateful that I'm one of the 152 to benefit from their program. Overall, 3 orthopedic surgeons have been trained under IOP. We have Dr. Kironde Edward, is a spine surgeon and the current head of department of spine unit in Mulago. He got his training here around 2016. Later on, we got Dr. Judith, who trained as a pediatric orthopedic surgeon. And then after her, I followed. And then, of course, after me, so many other people follow. They have not only stopped at training orthopedic surgeons, they have trained the physicians, internal medicine physicians, they have trained gynecologists, they have trained neurosurgeons. I think the first and yet the only neurosurgeon to be trained under them is Dr. Oscar Obiga, who left here about 6-7 months ago. And I think, Esther, you know him, is it? He is. So that's how things have continued to move. Now, we cannot only collaborate through other things. We also need to collaborate through research work. Before coming to Canada, I used to hear about Canada being the home of evidence-based medicine. And you cannot talk about evidence-based medicine without research. So partnering in the field of research is very important. During my short stay here, we were able to do some work to first start by identifying gaps in knowledge by doing a systematic review. I presented this about a week ago at the Fellows Research Day. And it was a partnership between me, Colin Cruz is one of the residents in the Division of Orthopedic Surgery, and of course, Dr. Peterson, and we were able to put this together and identify the gaps that I have on this slide. Some of the gaps that I mentioned up were actual findings of this research. 92% buy their own implants, 23% will only get the services they need, and so many other things that this study found out. So because of the gaps that we identified in this study, we then opted to start developing another protocol that will be able to cover 3 East African countries of Uganda, South Sudan, and Democratic Republic of Congo. And we are looking at evaluating the availability of specific orthopedic equipments and implants for specialist fracture care in East African countries. So we feel that a lot is not known, and therefore through this research, we'll be able to get a lot of information that can be used for decision making. We have decided to identify other partners. One of the partners we identified is a form of an alumni of the fellowship program here. That is Dr. Brian Madison. He's from South Sudan. He's going to partner with us to do this research. We've also identified one person from DR Congo, Dr. Jean Paul Vachia, who was my classmate in the postgraduate school, who is also going to partner with us. So in a few weeks, we'll have this protocol submitted for ethical approval here in Canada, and then subsequently the ethics board of the respective hospitals will approve. And we hope before this year ends, so by the beginning of next year, we have the data available that will be able to give to the respective institutions, of course, beginning with my own government, so that they understand what they have and what they do not have, and then they use the data to plan accordingly. Special appreciation, as I mentioned before, I cannot forget mentioning few institutions. St. Joe's Health System International Outreach Program have done a lot to make things work. I applied for this fellowship in July 2021. And between July 2021 and 10th of December 2022, I did not know where I was. I did not get any feedback. But because of the time difference between Canada and Uganda, which is about 8 hours, on the 9th of, it was in the night of the 10th, I got an email notifying me that I got a fellowship a position. And I wondered, why is this person sending me an email in the night? When I had the alert, I checked and it was notifying me that I've been given the slot. So then I had to start working on it to do the processing of the documents and the rest. So it's something that came at a time I did not expect. I'd almost given up. I thought it will not come. But there's a common saying that God's ways are not our ways. When something is to happen in your life, it's going to happen. And particularly to me, I've seen this happen. My undergraduate was not paid by me, it was paid by some institution. My postgraduate was paid by the Belgian government. The Belgian embassy in Uganda paid my postgraduate. And now my fellowship has been paid by IOP and its partners. So I'll continue to be very grateful. I'll not forget MacGlObAS. You've done a lot. I first met David on email and subsequently met face to face. They have really done a lot. They supported me do the foot and ankle skills lab program in Toronto. I'm very grateful for that. And all those who have partnered with MacGlObAS, McMaster University and its affiliated hospitals. I'm very grateful for the staff at the General Hospital. The surgeons, I'll not mention them by names. The anesthesia staff, I'll not mention them by names. The plastic surgery team, the nursing staff. Of course, I cannot forget Franca as part of the leadership in the nursing group, and all the other people who have done well to work with us. And of course, the people also the other side of the university. St. Joe's have sneaked into their theater on few occasions on invitation of Dr. Petriso, and then later on by what I'll call a friend of mine called James Yan. I've sneaked in to learn some few things. At the General Hospital, we do not do a lot of hip procedures. However, they're able to come at St. Joe's. So when they have those cases, they invite me to sneak their theater and then learn something. So I'm very grateful to all these institutions. And of course, the individuals, Dr. Peterso, we met a long time ago, and we've continued to interact. Without you, I would not have known about IOP. You made me know IOP, and IOP has made me what I am, and has provided me a platform from which I can continue to progress. So I must say I'm very grateful to you for what you have done. There are so many individuals. When I first came, I arrived in Canada on the 19th of June, no, on 17th of June. On the 18th of June, I met someone in the names of Chan Matthew. And I think Chan Matthew must be related to Dr. Esther. Chan took me to church. After that, he helped me go and procure a laptop because I did not come with a laptop. So they started my life in Canada by first taking me to church. After that, he took me for dinner. After that, he took me to go and get a laptop at Staples, somewhere in Ancaster. Yeah, so they've made my soft landing into Canada and life to be okay. And of course, with the welcome and the rest of the coffee I had with Dr. Petso at the main campus. So that is Uganda. I've told you about shortages in Uganda, but Uganda is not in shortage of everything. Uganda is rich in nature. Apart from the shortages in equipments and implants, there are also other things which are in plenty in Uganda, the wildlife and the rest. Each of these photos I've taken is from a different national park. I've put up is from a different national park. So there's a lot of nature. When you get the time to come, you can go to Massishon Falls. You can go to the source of the Nile. You can go to Queen Elizabeth. You can go to Bwindi National Park and see the gorillas and all the things that nature provides for the country. Otherwise, I thank you so much. For those who speak Swahili, asanteni sana. And for those who speak my language, Madi, which I know no one speaks here, I say Manjora. Thank you very much for giving me the opportunity, and I'm very grateful. Thanks a lot.